Hi, I'm Morse, the founder of Core Elements Training. In this video, we're going to demonstrate dry needling to the wider shoulder area, including the biceps and the triceps. We're going to focus on needling to common trigger points, and those trigger points we're going to needle today include the lateral head, the anterior head, and the posterior head of the deltoid, along with the biceps and triceps. This is a really useful needling technique for people that might be experiencing generalized shoulder pain and restricted movement conditions such as adhesive capsulitis, otherwise known as frozen shoulder. So the trigger points that we're going to focus on, most people can develop trigger points absolutely anywhere, but we do have common trigger points. And for this condition, it would be useful to palpate for those common trigger points first to see whether they're active and then apply the needling technique to them. So we're going to do two trigger points in the lateral head. One is commonly in the middle of the lateral head, and the other is slightly lower where the deltoid comes down and inserts onto the deltoid tuberosity. We're then going to needle into the common trigger point on the anterior head and the posterior head, along with, as we mentioned, biceps and 2 needles into the triceps area. So first of all, we need to cleanse the area. So we're going to cleanse the hands and cleanse the client's skin first. Okay, so just a little bit of antibacterial around that area. And then we're going to use our single-use sterile needles. Okay, so from here, we're going to focus on needling the lateral head of the deltoid first, and we're going to come into the middle of the lateral head. Palpate for the maximal area of tenderness, and once you've found that with your client, we're then going to do our perpendicular needling technique right into the middle of the lateral head. So the tube is going to go straight down onto the client's skin, then we're going to press that needle inwards and then lower that needle down about halfway. Okay, then we're going to always get that feedback from the client as to how they're feeling with that needling technique. Okay, and we're going to put all of the needles in first before we go into any activation methods. So when it comes down to the deltoid tuberosity area, we could again go perpendicular with the needle, but often when this trigger point is quite active or it feels quite firm, we will often find that there's a line of tension either running down towards the elbow or running up towards the previous needle. So in this instance, I'm going to use we're going to use the longitudinal direction. So the needle is roughly about 15 degrees away from the skin. I'm going to tap that needle in and then press the needle down roughly about halfway. Okay, then from here, we're going to come into the anterior head. Again, when it comes to dry needling, we're focusing on areas of tension and we're focusing on identifying where those trigger points might be. Okay, so once we've found it, we're palpating along the line of the joint here, and then we're going to pop the needle onto the anterior head. Again, press the needle in. Make sure that the needle is in before you take that tube off, because you don't want the needle falling forward onto the client. Okay, and then we're going to come into biceps. With the biceps, quite often we've got those common trigger points right into the middle of the belly of the biceps. Again, we could develop them nearer to the origin or the insertions, but for the purposes of today, we're going to come into middle of the belly of the biceps. Okay, then we're going to tap that needle in and again press down roughly about halfway. Before we put the needles into the rear deltoid and into the triceps area, we're going to activate those needles. If the client is feeling sensation already, then we don't need to activate because they've already got that sensation. But if they don't feel anything coming off these needles, then we want to try to create this sensation and look for the twitch response. So the twitch response sometimes looks like the muscle is contracting. Other times it can look like a ripple effect going through that muscular compartment. So we'll see that demonstrated in different ways. The first activation method that we're going to go into is flicking. So we're literally going to flick the needle bells once or twice to create that vibration going down the needle and into the tissue. Okay, if we don't get any sensation there, then what we can do is we can turn the needles. Okay, and as we turn the needle, we're winding the fascia up, or that connective fascia. It's winding itself around the needle. And the other activation method here, again, if our client's still feeling no sensation, we can then come into our peppering technique. So we're still supporting the client with your hand, and you're moving that needle up and down. So you're lifting up towards the tip of the needle, but the needle is still in the skin. And then we're pressing down roughly about halfway. And again, we're looking to see if there's any increase in erythema around the needle, which tells us that we've got an increase in localized blood flow. And we're looking for any twitch response in the muscle tissue as well. And we're also asking for any sensation from the client. Then going to pepper into the anterior head here, and again, pepper. So we're holding onto the top of the needle, not the needle shaft, as we activate the needles. Okay, and then these are now going to be creating that sensation. They're going to be reducing muscle tension, and as these needles are working here, we're then going to come round and place the needles into the posterior deltoid and into that triceps area as well. So again, on the rear deltoid, we can develop the trigger point absolutely anywhere, but commonly we'll feel the common trigger point round about this area. So you're still palpating for that maximal area of tenderness. And then once we've found it, we're then going to apply the needle. So again, the tube is going to come onto the skin, and then you're either going to press or tap. Make sure that that needle has gone down to the top of the tube before you remove this tube, so that the needle then doesn't drop out of the skin. And then once it's in, then we can press that needle down roughly about halfway. Again, before we activate this one, we're going to put our tricep needles in, just to give it time to reduce or calm down if there was any sensation when the needle went in. Okay, and again, commonly for the triceps, we might develop a trigger point on either of these heads. The common area is just here. Again, I'm going to come in with that perpendicular angle. And then we're going to needle transversely nearer towards the elbow joint as well. So again, we're placing these needles where we feel that we need them after we've palpated that area. So we're feeling for sensitivity from the client. We're feeling for areas of pain increasing when we press down on that area, and we're feeling for areas of tension too. Now it becomes more fascial as it comes down towards the elbow area. So in this instance, we're going to needle transversely, so across the fibers here. Okay, so our needle is pointing downwards as it goes into the tissue, but it's actually going across those fibers. Okay, so we've got these last three needles in here. We've got a slight amount of erythema around the skin here, which tells us that we're increasing that localized blood flow. So first of all, we're going to activate by flicking the needles. Again, our second activation method might be turning the needle. So we always start off with lighter activation first. And then from here, we could go into our peppering technique. And as we go into the peppering technique, we're taking hold of the top of the copper top of the needle, not the needle shaft. And we're moving up towards the tip. So the tip is in the skin still, and then back down roughly about halfway. The client often feels that sensation when we're doing that peppering method. Okay, and then finally, across the tissue too. And then whilst these needles are working to reduce some of that sensation and to reduce that muscular tension, then we could be working on another area of the body. Once we've taken these needles out, we then might follow up with manual massage or mobilization techniques around that shoulder area to help to increase that range of motion at the shoulder and to reduce that muscular related tension. Okay, so just to recap then, we've got needle into the anterior head, two needles into the lateral head of the deltoid, and a needle into the posterior head, along with biceps and triceps to reduce generalized shoulder pain or generalized pain and tension in the upper arm, along with helping to increase range of motion.
you.